Now, experts believe that this dipping of cases is good news, but is it? Let's find out. Let's talk about the entire scenario as it's panning out in our country to Dr. Rajeev Jayadevan, who's scientific advisor, IMA. Rajeev, hi, how are you doing today?
I'm good, Sudha, and you?
I mean, we are all keeping safe, and I'm coming to you live from home only because we want to be safe and secure and not kind of crowd the office space too much. Rajeev, a couple of questions. Number one, cases dipping. Is it a natural corollary, as it were, in the trajectory, or you think this is really good news for the country?
Well, we know that from experience about worldwide experience on Omicron from other nations, the rise has been steep and so has the decline. But there's a caveat here. People have a tendency to celebrate when they are past the peak as though they are scaling a mountain. It does not work like that. When you scale a peak, at least on the graph, we are faced with a lag of what is called severe disease and deaths, which will only arrive within the next few weeks. And that's first. And second, there is something called the tail that follows the peak. When the cases dip, many regions have a prolonged tail where the total number of cases will in fact be more. So we must be cautious about the news of relief as the so-called scaling of the peak. So I'll caution against that. But it is true that the total number of cases will dip rather rapidly in this pandemic. That is true. That is true with all the cycles.
And very well said, Rajiv, because I've seen people around me already planning their vacations, holidays, which they had deferred. So thank you so much. I mean, whatever you say always helps the viewers to kind of, not let their guards down. Rajiv, the other thing is that experts now feel, some of them, and, they feel that the whole variant cycle, as it were, is now perhaps over. Is it jumping the gun? I mean, and some of them feel no, it's going to mutate further. We have to live with this. Even if there are no new variants which challenge us, we got to never let our guard down. Any kind of studies in this regard, Dr. Jayadevan?
News about the pandemic ending has been in circulation ever since the pandemic started. So as the joke goes, it never ends. It's a continuous process, and this virus has unfortunately defied all predictions of the so-called experts. So I think we must remain humble in the fact that there are several things we do not know about the future. But if we look at the past 2 years, one thing is very clear, that this virus has a cyclical tendency which is not necessarily tied to seasons. See, if you look at common cold viruses, they arrive and disappear according to almost like clockwork by the calendar. But this virus does not do that. And that is the concerning aspect of this virus, because nobody knows what this virus is going to do next. For example, the Omicron variant came out of nowhere and surprised everybody with its super fast transmission. But fortunately for us, for whatever reason, the outcome was not as severe as that of the Delta variant. But we can't be sure that that will be the case for the next variant. We simply do not know, because the variants apparently emerge from immunocompromised individuals or even potentially from animals. We do not know that. So I would just like to say that it's very important to remain cautious while making such statements. I know people love to hear things that are relieving, things that are comforting, but science is not about comfort. Science is about facts and about safety. It is very, very important that we do not discard our standard precautions. I agree that during downtide times, that is when the pandemic is down, we can relax our restrictions to a significant degree, but we can't discard them. We can't we can't fool people into believing that the pandemic is over. And that is a mistake.
Yeah. Also, Rajiv, before I let you go, this whole debate about, was Omicron mild? Yes. Was Omicron mild? No, it wasn't. It really impacted me. So the thing is that you need to tell us, the number of deaths which have also happened. I mean, as we see, there is no huge panic about lack of oxygen. I'm sure the healthcare system hauled itself up after the last ridiculous tragedies which unfolded, which was denied by several politicians. But tell us a bit about Omicron. I mean, the three salient things. I mean, was it was it less cruel to us than the Delta variant? And also, did the deaths happen perhaps in those who had severe comorbidities? Would that be right to say, Rajeev?
It's a very good topic you raised, but I'll explain it in very simple terms here. It is sometimes difficult to explain observations in science in plain English language. So many people use the word mild when they actually mean it was less severe. Now, is mild the same as less severe? No, it is not. Okay, so that's the first distinction. The second point is Omicron in general affected a lower age group across the world. I do not clearly understand why that is, but the trend was clear from South Africa. The median age, which is the average age, was 2 decades younger. And I'm seeing reports from the United States here, which are tallied, and it shows the same trend. And the information we are getting scattered from across India is also that it's affecting remarkably the younger people rather than the older people. So that's second, which means that the severity, as you know, is exponentially related to age. So if the older people were, for whatever reason, vaccination or otherwise, were not severely affected, clearly the outlook, the total devastation will be lower. Now, let me give you the third point, which is actually a good set of numbers that I picked up from a study out of Kaiser Permanente from Pasadena, California.
Right.
They looked at a parallel series of Delta and Omicron patients who came to hospital. Okay. They found that the chance of getting admitted if you had a Delta infection was 1 out of every 50 infections. And with Omicron, it was 1 out of 900.
All right. Okay. And
I can rest my case.
So I think, so that explains it beautifully for everybody. Like you say, sometimes it's very tough to explain science in plain English language, but you did. As always, Dr. Rajeev Jayadevan, thank you so much for joining us on this broadcast. Thank you indeed.